and I'm excited to introduce our first of 5 speakers. We have Wendy Silva. She is an architect and a mental health lead for the design and technology practice at IBI Group. She works at the forefront of innovation and best practice in designing mental health care facilities. And we've asked her here tonight to try and get some insight into the years that she's spent researching how to design mental health care facilities in ways that support good mental health. And can we take those lessons and apply them to the more general built environment? So, over to you, Wendy.
Thank you very much. Well, great to be here. Thank you for inviting me. I'm an architect, actually, not a researcher. I've been practicing architect for over 25 years, and a lot of that work has been in the field of mental health. And I think it's great that mental health care is making the news for good reasons for a change. It's in the news because there's been quite a lot of positive outcomes around it. There's work about parity of esteem between mental health care and ordinary health care, ordinary illness. There's also, I think, been quite a big change in the way clinicians are approaching mental health care. And one of the things that I'm beginning to see is a lot more said about the recovery model of care. And the recovery model of care is not about what services do to or do for people. It's very much more about what people can do for themselves, how they can be empowered to support themselves to live meaningfully within their community. And I've designed a lot of hospital buildings and mental health care buildings, and I'm going to use Kingfisher Court, which is a project I was involved in when I was with P&HS Architects, to illustrate some of the points for this talk. And the brief for that project was to design a building which supported a recovery model of care, which is a brilliant place to start, but I didn't know what it meant. I don't think many of us know for sure from our different areas what it means, but we're gradually beginning to develop an understanding, at least us in the design world. Our clinicians will have a different view on it, I'm sure. So what did we do? We had a lot more consultation with service users and clinicians than is usual, actually 2,000 hours over an intense 3-month period. And I was enormously challenged by this. I just could not understand why it was taking so much more time. And then gradually the penny dropped. What the Hertfordshire Partnership Trust were doing was that they were using the design process to empower their service users. And they were playing a very meaningful part in the design of this building. It was a 86-person inpatient unit in Hertfordshire. So they were actually using, this was the recovery model of care in action that we were seeing. And what did we hear from service users? We heard that one of the most important things for them was good connection to the outside space. Actually, free access to the outside space was important, as were views out. And why? Lots of reasons, but they did include this feeling of containment that you get when you go into a unit, and the emotions, often negative, that go with it. And having access to outdoor space made a huge difference to them. Other things that were on the list were things like non-institutional building, light, airy buildings, places to rest, places to sit, places to watch the world go by, variety of places, not things that you might get in the clinical brief, were highlighted as being important. The other thing, these are some courtyards and also views out. The other thing that we did is there's this street pattern which goes through the whole complex. Was designed a bit like an Italian hill village. We had art involved, we had particular bronzes and places to stop, places to shelter, places to be safe. And all of these were things that were identified right at the outset as being really important to the service users and also clinicians. We worked very well together as a group in developing the brief for this this project. Between the ranges, those two ranges of buildings which went down this hill, and between the ranges we had two shared gardens. One was for horticulture. We had orchards, herb gardens. The other was for sport and leisure. We had outdoor gyms, for example. And another important thing that we did was we had a public footpath went through the adjacent woods, and we made connections to it from the whole unit. And this was for service users, but equally importantly, it was for the public who also used the building, because it was very important for all of us that the stigma associated to this. This is called Kingfisher Court. It's in Kingsley Green, but those of you in the know might recognise Harperbury Hospital. We really wanted to make a change from then to now, and this site will soon have housing and schools adjacent to it. So integrating it into a community was very important. This just shows you the whole site in its context, and this the larger context, which will soon have housing associated with it as well. And I think one of the lessons for us in doing this and all these hours of consultation and the learning is also about dignity. One of the service users, I mean, there were many, many lessons that we learned in this process, but one of the service users said to me in an early stage of design, when we had a cafe with a service counter which faced the foyer and a hatch to the inpatient side, she said, you know, I really, really feel like a second-class citizen here. I would like to be able to go out and use it just like anybody else. What that meant, and 50% of the people in here were under section, was that a member of staff would have to accompany many of the people out there. And she said, well, isn't that a price worth paying? And of course, you know, the decision was taken that it was, and that's one of the things we did. And I think the investment that we made, we had 5 different types of art in the project which related to different people. The investment that we made in time and also in money made a difference to the outcomes that we got from this hospital. The early evidence is that it is making a difference. One of the figures is 23% improvement in engagement between staff and service users, and 50% of service users feel that the staff are paying more attention to them and valuing them in delivering and preparing their care plans. So these are very tangible clinical benefits that are coming out of it as well. How does this connect to a city? Well, one of the things that we have to do, or we're being empowered to do at the moment, is the Care Act, the 2014 Care Act, actually asks local authorities, demands of local authorities that they look after the public health of their populations and start consulting with them. Some of the lessons I think that we've learnt in the consultation process at Kingfisher Court are very directly transferable here as well. But I asked some of my colleagues who are working at Bhubaneswar in India what they would say, and this city has actually just won the poll, come top of the poll in the Smart Cities competition in India. And one of the things that Bhubaneswar is in northeast India. It's now about 1 million. It used to be 10,000 people. One of the things that this municipality did was it polled all its population, and 300,000 people came back, not surprisingly, with wishes that were about the infrastructure, better transportation. 200,000 people, better water, waste services. But the next highest thing on the list was open spaces and heritage hubs. So I think it's a common denominator between hospitals and cities that we humans have similar needs, have the same needs of our environments. And I think the lessons I would take from this is that we really need to empower people, we need to invest into spending the time to share, to gain from people, help people articulate their needs, and we need to listen. As designers, we need to use our listening skills as well as our design skills to help people to